First of all, welcome everybody. You're at the Weird Name panel. I'm Talha, Bashir, and Svi. Also, we're going to talk about healthcare technology and innovation. So first of all, let's all introduce ourselves. Svi, why don't you go first?
Thank you. My name is Svi. I'm CTO and head of infrastructure for Memorial Sloan Kettering. Relatively new to the industry. I've been here for about 3 years, just as we call it BC, before COVID. And prior to this, studied here in financial services, last job, CTO of Morgan Stanley.
And we know that Bashir is very important, has a hard out, so we're going to try to get him in as many questions as possible before he has to leave.
Thanks.
Bashir,
I'm Bashir. I'm the CTO at the Hospital for Special Surgery. HSS, we are the leading orthopedic hospital in the nation, ranked #1 for the 13th year in a row by US News and World Report. I've been with the organization about 8 years. I came to HSS from Memorial Sloan Kettering, where Steve's at right now.
Were you colleagues then?
No,
Okay.
he joined after I left. But I like to say that I grew up in that organization. Again, fantastic healthcare organization, doing something great for the community. Prior to MSK, I worked for a technology services company, a small company out of Jersey. And prior to that, I worked overseas because I studied and grew up overseas, started my career there, had the opportunity to emigrate to the US. And I've been in the industry for quite a while. Happy to be here today.
Great. So is my mic too loud? It seems like it to me, but I'll give a quick introduction of myself. My name is Talha Bassett. I am the founder and CEO of Spiral.Health. We are a health technology company that is looking to revolutionize the way data portability works. So I'm very excited to be here and talk to all of you. This is a topic that is near and dear to my heart. I'll just rip through my bio real quick. A couple tours at Apple, lucky with a big exit to United Healthcare, worked at an AI ML company, and I decided I'm going to do my own thing. And so here I am, trying to facilitate this conversation. So really happy to meet everybody. And please find me afterwards, and I'm happy to talk about any of my experiences. Also, I know we're in New York, and you all think that all those smart people are in New York. I'm a Californian person, and so I flew in here from California. There's a lot of technology being created out in California, in case you were concerned that was only happening in New York. So, all right, well, great. Thanks, everybody, for introducing themselves. I think we're going to start talking about BC and then AC, I guess, after COVID. And I think, as both of you know, COVID really decimated the financial ability of hospital systems and HCOs because all the beds were filled with people who were not getting all of the procedures that US healthcare gets a lot of money on. So I'm curious, each of you could maybe talk about what you saw during that time and what you're seeing now as I don't know if we're in a post-COVID world, but we're in a different world. So Svi, why don't you go first, since you've got less time than everybody else.
Let Bashir go first.
Oh, okay, well, he just passed the ball to you. You're up.
Sure, absolutely. So I would say, as with many of your companies and industries, the pandemic was a really business changer for many of us. So for us, we're a specialist hospital. We went through a process of transformation during the pandemic where at some point we actually took in COVID patients, converted ORs to intensive care units, anesthesia machines to ventilators. We did transformation that we hadn't even anticipated we'd have to do.
Can you talk a little bit how that decision got made? Because obviously HSS is not a bed for respiratory disease. So how did the organization decide this is what we need to do?
Well, so early on, even as before the state decided that elective non-critical care should be suspended to preserve medical supplies and all, our leadership had already started thinking about, maybe we need to stop, all those non-essential surgeries. And at some point, we thought we would take in the overflow of patients from MSK, from NYP.
Sure.
We're all in the same sort of neighborhood. And then we quickly shifted to, just taking in COVID patients. And that represented major transformation for us, not just clinically, but also from a technical perspective, because now our teams had to come up with solutions that we hadn't had a need for to monitor patients in the rooms in isolation. We had to quickly engineer, remote monitoring type tools and stuff. And virtual care.
And did you do that mostly in-house? Did you buy solutions?
We did mostly
'cause
in-house.
The urgency was
Exactly.
really high, and so I'm curious how you pulled that
Yeah,
off.
we did mostly in-house.
Great.
Because some of the technologies that were out there, the manufacturers weren't just ready yet to be HIPAA compliant. They said,
We're
"Hey,
going to
you
get to
can-"
HIPAA and SOC
Exactly.
2 and all that stuff later.
Yeah, so that was quite an experience for us.
Yeah. Zvi, do you want to talk about that?
Sure. So very similar to Bashir's example. The need for us to move quickly to telemedicine was immediate and mandatory, as well as, of course, to move our workforce to be a hybrid workforce. I say hybrid because at all times the hospital was open. We could not still send people home and say, sorry, we are closing down. It required us to really enable remote working for our people, but also really make also sure that we protect our patients as well. So, for example, the patients that had COVID and were hospitalized, we created a set of things that could really help them to feel more comfortable. There was the bed themselves. We have smart beds, so the bed themselves will make sure that they are lying on their stomach and on their back, because part will make a difference. We added iPads to each one of them, so they will be able to communicate and be able to do things. And also the bed itself, let's say, took the vitals every 10 minutes, the oxygen, the blood pressure, etc. So there was no need for a nurse to get in and do that. So those are kind of immediate things that we had to step on to do. I think that the biggest change is the fact that while telecommuting was around for many, many years, there was always suspicions about would people be productive, would they actually
Sure.
work.
Those all got answered, right? All my staff still worked. Everybody works. It's okay.
It's working.
Yeah.
So that's basically.
So, well, I know you have a short clock, and I was very excited to talk to you because of kind of your background. So I'm going to ask you a question that's off the book, and that is, you were in fintech, and now you're in health tech. This is my third health tech startup that I'm in now, and I love it because there's an opportunity to make a real impact in real people's lives. We can all make money in whatever way we want to do it, but the mission of health tech is really important to me, and I'm curious what your perspective is moving from fintech to health tech.
Quite simply, I mean, I was joking with my friends in Morgan and JP Morgan and Goldman, etc., and about the fact that their goal is to make rich people richer. Our goal is to save lives.
Yeah, I don't need to get richer. I'm good.
Yeah, no, seriously, I think that the interesting thing is that the revolution and evolution that the financial services went several years ago, that forced them to be in the front end of technology, was late to come to healthcare. But it's now here, it's happening.
For sure, health tech.
Because of, we don't have a choice. We have to move it, we have to move fast, we need to be at the front end of this. That's one of the things. The second thing is that the discovery of the genome, the ability to understand the genome now made a huge difference in the way we treat healthcare.
Precision medicine, right?
A lot of our treatment today is done we start with genomic sequencing.
Yeah, precision medicine is a real thing.
People,
Yeah, it's exciting.
Yeah, no, and we start with genomic sequencing of people's status, etc. We're trying to create biological agents instead of just radiation and chemo, and we're trying to really move into personalized medicine, which is basically every person is analyzed for the best treatment for the person himself.
I know a founder and CEO who's running a startup that's going to lean into that thing. You might want to talk to him later. Are you still able to stay? Because I know you had a.
I have until 10:15.
Oh, okay, great. Great.
So, yeah, thank you. No, but seriously, one example was that about 3 months ago, it was published that a treatment was created by MSK for people that have rectal cancer, went through testing and all the way from late stage, terminal stage to early stage. And for the first time in history, the percentage of remission was 100%. So everybody was cured.
So I want to get through.
Never happened before, and it's all due to genomic sequencing.
I want to get through, we have a really short amount of time, and this obviously is a super passionate topic for me. I could talk for hours on this. And if you talk to my staff and investors, I do talk to them for hours on this. But let's move on a little bit. So one of the things I want to talk about is innovation in health tech, because we have HIPAA, you've got to go through SOC 2. I've come from a different industry too, which is writing distributed internet applications in Silicon Valley, and you don't have any of those regulations. And so I'm wondering how are you seeing companies like mine that are going to come with new innovative ideas, and how are you going to onboard them? How do you evaluate them? Because two of you could be a future customer of mine, so I'm curious how you look at the new stuff and how you evaluate it and how you get it into the use. Why don't you go first, Sure.
Yeah, so we approach that from multiple angles. So, for example, at HSS, we have an innovations institute,
Okay.
whose mission is one.
Do you have their phone number? You can give it to me.
Yeah, afterwards, I'll see you. So they, the focus is inwards and outwards. So they look at our IP, because we have a research organization. We're the global leader in our space.
Yep.
A lot of advancements in care comes out of our organization. So they look at opportunities for monetizing our technology, or partnerships with external partners. And then also they talk to startups and other companies out there, either for direct investment in those companies,
Yep.
or to bring their technologies in. Then also, sometimes different business areas in the hospital come in contact with startups and established players who have an innovative technology they want to sell to healthcare.
Sure.
And so those are the various ways. And sometimes to us in IT, you find a company somewhere, you go to a conference, and then you say, oh, this guys look interesting. You come back home and say, hey.
Are you Epic, Cerner, or all
Epic,
the above?
Epic,
Okay.
yeah, Epic, yeah.
How about you, Sphere? What's the EHR system that you're running?
We were very socialist. We had one of everything. We are trying to move one.
Do you have Athena too? You have Athena and all the other ones too? Epic,
Name
Cerner?
it. We have two of them.
Sure.
No, but we are moving. We are following Bashir. So whatever he does, we do. So we're gonna go to Epic.
There's a seismic change happening in health tech right now. I don't know if everybody's aware of this, but Oracle just bought the #2 EHR, electronic health record company, Cerner. And so they're realizing, as little startups like mine are realizing, that there is, because of the 21st Century CARES Act and bulk FHIR, which is a protocol that's going to finally allow interoperability of healthcare data for the first time. This is a seismic change as big as HTML or HTTP and the explosion of applications and value creation on the web. And it's going to be forced on Epic and Cerner, because they did not want this to happen, because it's not in their financial interest, in January of 2023. And I can tell you, while I'm out here helping Anthony, my software engineers are heads down working on an MVP to show how this is going to work. It's going to be an enormous game changer. And Oracle saw that, and that's why they bought Cerner. So there's going to be a lot of change and innovation happening in health tech. It's really, really an exciting time. And so if you're not that plugged into it, I would encourage you to kind of find out. There's going to be a seismic change in this stuff, and it's going to require CIOs and CTOs to understand what the moving parts are and make the best decisions for their organizations.
Let me just add, and with this I'm going to finish, that in terms of innovation, we are looking at many, many other areas as well. One of the things that we are implementing right now is conversational AI as our front end for help desk, tech support, and many of the other things. We are using the Amelia software, but we are moving very fast to do that, and that's a game changer, a dramatic game changer for us from that perspective. And there are other types of innovations that we are looking at, such as augmented reality for surgeons, and so on and so forth.
There's a lot of companies doing that.
As I was saying, what financial services went a few years ago, which is rapid innovation and march forward. This is now the spring of healthcare, if you may.
Yeah, I completely agree.
With this, I have to say goodbye. So thank you so much.
Thank you.
Best of luck. Apologies that I couldn't make it.
Cheers.
Thank you.
I'm going to spend just a couple more minutes with Bashir,
Sure.
and then we'll actually end on time. So, do you want to answer that question about? I lost my train of thought. What were we talking about? Sorry.
Innovation?
Yeah.
Yeah, so
Yeah, it's the CIO Innovation Summit, right? Okay, yeah.
Yeah, so besides the healthcare innovation which comes at us from different angles, internally, externally, partnerships. Within core IT, as Steve said, we're also looking at making some major changes in our service management efforts. Joe, who's a member of our team, is leading a service management transformation there. Also, we're looking at conversational AI type technologies to transform customer service within the organization. I think one of the takeaways for me for the post-pandemic transformations that's happened everywhere is finally organizations have come to terms with the fact that when we say digital transformation, we cannot neglect what's called in some quarters workplace strategy, digital workplace strategy. You focus on customer service, patient experience, and all of that. You transform what you see, your channels, your products. But many times we neglect operations within our enterprises.
Sure,
and COVID pointed out to us that if you did that,
the reason that's bad is that those things won't get adopted, right? So you have to be
but now there's
that.
focus on that. Now, so now you recognize the fact that your folks can't work remotely if they're still waiting on a paper fax.
Sure.
And if someone's still walking the hallways with a pile of paper for somebody to sign. So we need to transform internally as well within the organization. So a lot of efforts now been put into a digital workplace transformation as well as a component of your overall digital strategy. So that's a focus for us. And allied to that is this new concept of digital employee experience. Because now, again, we spent the last several years thinking about patient experience, doing patient journey mapping, trying to remove friction anywhere we can at every point of contact with the patient. Now, looking more inwards, say, okay, how do we do that for the employees? Such that when you work from home, when you're in the office, in the regional office, your digital experience is as frictionless as we can make it.
And I think that's a good capstone to what the product manager from Google Chrome was talking about right before us. So
absolutely.
Is there, we're out of time, so we're not doing a Q&A or anything, right? So we're done? I really appreciate everybody's attention. Come find any of us and ask us more questions about the cool stuff we're working on. Everyone, I'd love to talk about it. Thanks.
Thank you.